Good evening, welcome back to my no-name channel. I'm Bruce, and actually my channel's named Bruce Pullman. I don't know, I just like saying welcome back to my no-name channel because I don't have any fancy name for it. Okay, so lots of stuff to do as usual. Thanks for the comments and likes and for viewing, and let's get started with the numbers first as usual. Okay, the numbers. What do we have? 141 new cases. That gives us a total of 40,318. 37,582 recoveries, 179 this past week. 1,158 deaths. And 1,578 active cases, gone down a little, 43. And so 113 local and 28 domestic travelers. So 141. We're stuck here in the mid hundreds most of the time now. And so it's not getting better. The vaccination is ongoing. As you'll hear in a minute, I'm going to give you some numbers on that. Before I forget, when I start talking about vaccinations, there's the Indonesian test for COVID-19. It's called GeNose. GeNose. I call it GeNose. I don't know, a couple of different names there because I wasn't sure. I looked it up, of course, on Indonesian television production news station. GeNose. Okay, so let's take a look at the numbers around the island. Denpasar 54, Buleleng 7, Badung 31, Tabanan 45, Bangli 2, Gianyar 25, Klungkung 3, Jembrana 2, and Karangasem 2. And so where are we? Well, this is an interesting and kind of disturbing news here. 3 out of 5. There are only 5 red zones around Indonesia now, according to this article that's linked down below, and 3 of them are in Bali. Yeah, Buleleng, here, my neighborhood, Tabanan, and Denpasar. So even though Bali has a relatively low number of cases, the zoning system is not based on just cases alone. There are 15 main indicators, and 11 are epidemiological, 2 are public health surveillance indicators, 2 are health service indicators. And so red zones have high transmission rates, and so we have 3 red zones here still. Buleleng is one of them, unfortunately. And so, yeah, that's disturbing. So here we are. We're April 4th today, I guess, and we're still stuck here. What's that going to say? Well, everybody's hoping the numbers are going to go down as the vaccinations spread, and I'm going to talk about all the different vaccinations. Just here's something that's new because it just came out. I just found it this morning because I recorded the vaccination stuff last night. 96% of the population of Sanur has already been vaccinated. So that's great news. That's a green zone. So, yeah, I don't know. It's not, the numbers are, yeah, they're okay, but they're not okay. It's a lot better than when we're at 600. That's better than what's happening in parts of Japan and in parts of Korea, in the U.S., Brazil, India, in a lot of places. But it's not good enough for us right now for tourism. Now, there are people that are going to come here, as I've said before. If we had 1,000 cases a day, they would probably come. Why? I don't know. Some people say, I'm bored. Too bad. So anyway, I don't know. Let's get on and look about vaccinations. So there's a lot about vaccinations today. Why? Because vaccinations are the key, what the government sees in a lot of governments around the world, the key to ending this and the key for Bali opening up. There's that magical 70% herd immunity that we're trying to get all over the island, well, all over the country eventually, but all over the island so that Bali can open up for tourism. So there's a lot on vaccines and vaccinations, and so let's get started. Okay, and we're going to talk about vaccinations. And so according to the governor, a total of 580,000 people have been vaccinated already out of the target 3 million that he says. Remember that the tourist minister, Sandiago Uno, says that 2 million. The governor says 3 million. Now Sandiago Uno is saying 2 to 3 million. And so we've got 580,000 out of the total of 3 million. And the 380,000 have had the first dose, and the rest have had 2 doses. And that's great news. Great. Are we going to get there? This is April 3rd, I think, or 4th. Are we going to get there by June, so we can open in July? We'll see. All tourism workers targeted for vaccinations in Lovina. So this is up in Bulgarian in my area, and so tourism workers in the Lovina area have been getting vaccinated recently. This is part of the Green Zone program for Bulgarian. Bulgarian is not one of the 3 Green Zone areas, Sanur, Nusa Dua, and Ubud, that the government announced, but the Bupati wants this to be a green zone, and so people are getting vaccinated here. And 700 this past week were registered for the vaccination. Said in the article, people are very enthusiastic about getting vaccinated here, but there was only 400 doses available, and so we need more vaccine up north. And well, we've asked for it. Well, not we, but the government has asked for it, and hopefully we'll get that. And vaccinations continue around the island, although there are some shortages in places like Bulgarian and Tabanan, which I'm going to talk about shortly. And so, first, public health experts raise concerns over government decision to allow the, I'm not sure how to pronounce this, GeNose test for air travelers. And so the last video I mentioned that the Indonesian government announced that it would allow the use of the, I guess it's GeNose COVID-19 detection to fulfill the test requirements for air travelers across the country, starting on the 1st, a couple days ago. And so the Indonesian COVID-19 task force said that air travelers could present a negative COVID test result from the PCR test or antigen rapid test, or they could take the GeNose test, which could be done at the airport. Except it's only available right now at 4 airports, and Bali is not one of them, Merah is not one of them. So I'm not sure when that's going to show up. However, several public health experts are urging officials to revise the policy. Pandu Riono, an epidemiologist from University of Indonesia, said that the test is experimental and should not be used. Quote, "The policy must be reviewed, especially when the task force applies this as if the level of accuracy is on par with PCR and antigen rapid test. That is an inaccurate perspective, and people will definitely opt up for the easiest method. This is reckless, using inaccurate methods of screening equals allowing continued infections." And Amedu Tomo, an expert in molecular biology, agreed and noted that the test that was developed in here in Indonesia, Gajah Mada University in Jogja, has not been reviewed in scientific publications, and even though it's been approved by for distribution by the Health Ministry last year, and the device uses an AI to detect possible COVID infections through the human breath, and the test is cheap. It said in this article it only costs $30K compared to $250 for the antigen test and the $900K for PCR test. But as I'm going to mention in another article, they're going to be charging $40,000 for it at the airports. Okay, so that's going to be there. And is it going to be here in Bali? I imagine it will be soon. We'll see what happens. Is the government going to pay attention to these two scientists? I don't know. But we'll see what happens. Okay, and next, super-speedy Israeli COVID test gets approval to be from Europe, and airport rollout is planned. And so an Israeli company said it's received EU approval for a rapid COVID test. The handheld spectral light, or lit, machine eliminates the need for complex lab equipment by shining light through samples and giving immediate results within 20 seconds using spectral signature. So staff that collect the samples, okay, they collect the samples at the airport, they can just run it through the machine, and here's a photo of it. They can just run it through the machine, they get an instant result. That's great. A swab version of the test has been approved by the European Medical Devices Directive, and there is another version, a gargle version, that uses mouthwash that should be approved soon as well. And so this has about 85% accuracy, and they expect it to get better as it's used and developed more. So that's good. If you can get these tested, you can do this rapidly. It would mean that you wouldn't have to get tested beforehand. You can take a cheaper test, get it done right at the airport. Up-to-date information. There's no chance of having counterfeit documents, right, which has become a problem everywhere in the world. And so we'll see what happens. I'm not planning on traveling, so it's not going to affect me, but there are going to be a lot of people. There are a lot of people traveling now, more and more people. And any updates to testing that can be done at the airport quick and cheaply is going to be a benefit for opening things up. Okay, and next, and more on vaccinations. The chairperson of Commission 4 of the Tabanan DPRD, Igusti Koman Wastana, said his party strongly urges the Tabanan Education Office to immediately implement face-to-face learning. Moreover, he said, one region, Gianyar, had already started face-to-face learning. Now, I haven't seen anything on this officially, but when we were out on my trip a couple of weeks ago, we saw kids wandering around wearing school uniforms. So, don't know what that was about. He said his party will call the Tabanan Health Office regarding the extent of the need for vaccines for teachers because they are a priority during the COVID-19 vaccination process. He said steps can be taken to speed up the vaccination process so that schools can be open by July. And he added many students miss face-to-face learning, and they find online learning quite difficult. And he also said, like this one, teachers are becoming bored with distance learning. I like that. That's good. I don't know if that's true or not, but I found it kind of funny. Okay, And next, and more vaccinations. 16,000 teachers to be vaccinated ahead of face-to-face learning. So the head of Bali Youth Sports Agency is targeting all teachers and educators to be vaccinated for face-to-face learning. Schools will be opened in July once all teachers are vaccinated. Second dose should be finished by May, and June is the holiday month, and then July will be, everybody in Bali will be back in school for the new school year. Hooray! The first 3 months will be 50% online and 50% face-to-face. According to this, not real crazy about that. So far, 11,160 teachers have been vaccinated out of a total of 16,000 teachers. So that's good news for those of us that have children or grandchildren. Yay, back to school. Okay. Okay, so last video, I mentioned that I was going to talk about this beach issue because it's an important issue. And it's an important issue if you're coming here and you're planning on purchasing something or renting long-term or renting short-term even. A villa, you know I hate that word, villa, but someplace that says you have a private beach. And this was a problem I talked about last year, way last year, when I first started doing these. A family that had rented a villa up in the north here, told they had a private beach, and they tried to kick some locals off that were there, from people from the neighborhood who were out enjoying the beach in front of their villa, and they said, hey, this is our private beach, and it wasn't, and problems. Okay, so another problem here, viral video of of a woman who said that she was told to get off the beach in front of a hotel in Sanur, and this sparked a discussion about privatization in Bali. So a series of videos by a woman claiming that she was kicked out from a beach in Sanur has been widely circulated, and this was last week, and reignited a discussion about privatization in Bali, especially beaches. And so the video was uploaded to Instagram. The woman said she was kicked out of the beach in front of a hotel. A hotel security guy came and asked her, she was sitting in front of the hotel, asked her if she was a guest at the hotel, and when she said she wasn't, he told her to move on, to go to the next one, and she said she was shocked to learn that the beach was private because she's a local woman, and she said she used to play there when she was a kid, and suddenly she's told, no, this beach is private, get out. Well, the video was reposted in Bali's community accounts, with many viewers commenting that such incidents occur often and not just in that area. And the head of the Denpasar Tourism Agency said, such an incident should not have occurred. Maybe we will approach the hotel to clarify the incident. The beach belongs to the public, not any hotel, that is clear. So such things should not have happened. And beaches across Indonesia are open for the public. They're free and open for the public, as reflected in the 2016 presidential regulation that sets a minimum of 100-meter boundary limit from the highest tide point to the land. However, this is often ignored, not just by hotels, but by businesses, restaurants, clubs that set up right on the beach and then claim the beach land for themselves. Okay, so beaches are free, and that's to our next one. Beaches are free in Bali. The hotel apologizes for the beach controversy. The Bali hotel owner, who was at the center of the privatization controversy, acknowledged that beaches are public property and that his staff should not have kicked the local woman who was sitting in the sand in front of the hotels. They should not have kicked her out. Ida Bagus Gede Siddhartha Putra, who owns the Pariwisata in Sanur, said he's notified his staff that all beaches are free, including the one in front of the hotel. They're free and open for the public. He said all beaches belong to the public, And so if there are any public activities such as fishing, simply visiting, traditional ceremonies, the hotel has no right to restrict them. He said that in the 50-year history of the hotel, this is the first time a non-guest has been ejected from the beach, and that the lesson he's received from this is need better training for hotel staff to avoid miscommunication in the future. So I don't know, he's putting this off on the staff. So the young lady who posted the original video uploaded another one to say that she met with hotel management and the issue's been resolved, and that she received an apology video from the security guard in question. And her husband said, hopefully with this incident there will be no more discrimination against local residents visiting the beach. Okay, and so if you were told that you were getting a free a private beach, you're not. There are no such things as private beaches in Bali, so you should check. And if you don't think this happens regularly, put in a search term, villas with private beaches Bali, and take a look. All sorts of places advertise private beaches. There are no private beaches, okay? So if you come and you're told there's a private beach and you're paying premium prices for it, you're paying premium prices for nothing. And if you try to run off local residents, you're going to get some problems, and rightfully so. Okay, so enough with that. Let's go on. Okay, and so let's talk about what things are going to look like when they open up. And right, everybody is still looking at July, right? So quarter travel plans. Foreigners must quarantine 2 times 24 hours in the Bali Green Zone. So this kind of answers the question. And remember, everything is still flexible and fluid. But this kind of answers the question I was asking last time. We'll get to that. So Pak Sandiaga Uno, our old friend, revealed more about the continuation of the travel corridor arrangement. And according to him, the discussion is ongoing and finalization is imminent. Everything is being coordinated with the foreign minister. Preparations are being made in terms of tourism products, preparing the green zone, vaccinations, and so on, so that tourists feel comfortable and safe. And visas are also being revised, and I'm going to mention that just a little bit at the end. And these are e-visas, and this should simplify the process of getting visas. On arrival, tourists will take the PCR test, and while waiting for the results, will self-quarantine for 2 times 24 hours, and then be free to travel around Bali for 60 days. So there's going to be the 60-day visa that you'll get, and you can go anywhere in Bali, not just the green zone. You're going to be quarantining in the green zone for 2 days. But this is all in process, he said, so please be patient. Those famous Indonesian words, please be patient. And he added that even though India's been holding back the virus, everything is working okay, and vaccinations are still underway, and he's confident that there will be 2 to 3 million people vaccinated before July so that things can open up. Okay, so that's it. So my question was, right, how are you going to keep them in the green zone? Well, you're not. The green zone is going to be for quarantines, according to this. And then they can go anywhere they want to. And, well, there's news coming out, you may have seen, that if you get vaccinated, depending on the vaccine, I don't know if this applies to all of them yet. This just came out the other day, and I haven't had a chance to really go over it. That you that you will not get the virus, and that you can't pass it on either. And so if you're vaccinated, well, you're free to go, and you're not going to get sick, and you're not going to make anybody else sick. So, good news. Okay. Okay, and next, government revises several entry requirements for domestic tourists. So this includes you, if you were traveling around Indonesia. Requirements have been revised, and they start this week. They started, I think, on the 1st. GeNose is allowed, as well as negative test results. So, and this was, I was trying to find out how to pronounce this. I mentioned earlier GeNose and GeNose. GeNose is what I heard Indonesian newscaster call it, GeNose. So we're going to go with GeNose. So GeNose is allowed as well as negative test results. And both a swab and rapid antigen test are only valid for 2 days prior to departure. GeNose can be done at the ferry, at the harbor, before you get on the ferry, or at the airport before boarding. Children under 5 do not need tests. Each traveler has to fill out the electronic health access card, the EHAC, upon arrival. If individuals show any symptoms despite having a negative test result, they will be required to take a swab test and will not be allowed to travel. Okay. GeNose is 40,000, so there was a lot of things that was said it was 30,000, but you're going to be charged 40,000. Each traveler is required to comply with the prevention protocols. That includes wearing a face mask, and it's either a surgical face mask or a 3-ply face mask only, said. Keep physical distancing, frequent hand sanitizing during the trip. Food consumption not allowed during the last 2 hours of the flight. And the government hopes this new policy will have a positive impact for tourism by being lenient, but still keeping everyone safe. On the bad tourist report. So, police arrest a Bulgarian national for breaking into ATMs. Okay, and we've got the Bulgarians back at it again. A 20-year-old Bulgarian was arrested for breaking into and skimming ATMs. He was arrested at his guest house in Canggu. Surprise, surprise. He had broken into ATMs in South Kuta, Canggu, Seluruh, and Lombok, and apparently had been in jail back in Bulgaria for similar crimes. And he is no longer on the streets. And visas. Okay, so this 5-year plan really hasn't been solidified yet. It's there, and I'll talk about this next week. I don't think anybody that I don't know how many people are going to go with this, but more on that next week. But immigration has released, and it's a link down below, and I strongly urge you to read it. You can't, it's in English, and the link's here, and I'm going to read this now, so I'm going to have to read this. I'm going to read this off the computer, not on my notes, because I didn't write all this stuff down in my notes. Okay, so visas and state permits. So this is the policy, came out sometime in the last week. And there's a link below, please read it, but I'm going to go over the highlights here. And so, it says, you will be allowed to enter Indonesia if you're a holder of A, official visa, diplomatic visa, visitor visa, temporary stay visa, official stay permit, diplomatic stay permit, temporary stay permit, permanent stay permit, active crew members on board, Asia Pacific Economic Cooperation, APEC, business travel card holder, and traditional cross-border documents. Okay, so if you have one of those, and next page, so this is all on their Instagram account, visitor visa lets you enter Indonesia for essential and emergency work, business meetings, selling goods, probationary foreign workers, medical assistance and food supply, joining the transports as active crew members, Temporary stay permit is granted for working activity and non-working activity. Temporary stay permit for working activity allows you to work as a professional or expert, join on ships, vessels, or any installations in Indonesia Maritime Zone, Territorial Sea, Continental Shelf, and Indonesian Exclusive Economic Zone, supervise the quality control of goods and products, inspect or audit at company branches in Indonesia, do after-sale service, install and repair machines, do non-permanent work in construction, and work as probationary foreign workers. Okay. And temporary stay permit for non-working activities, just 3 things: foreign investment, family reunion, elderly tourism. So elderly tourism is what they're calling retirement visa now. And it says in red on this page, big bold, free visa and visa on arrival are not applicable yet. So you can't get that. And when applying for a visa, please send a visa application letter to the Director General of Immigration via email. And visa application letter must include sponsor's identity, foreigner's identity, sponsor's email, sponsor's identity card, and application number. So you need to have a sponsor. Okay? Can you get a visa, a business visa? Yeah. Seems like it. After your application is approved by the Director General of Indonesia, you will receive a token number in your email to apply for the visa at, and then there's the visa online immigration site, and you can verify the validity of your electronic visa by scanning the QR code or checking it on another Indonesian website, the immigration website. So that's pretty simple compared to the old days. You can do this online now. And it says, for further information about the circular letter of Director General of Immigration on visa and stay permit policy in the new normal, please visit www.imigrasi.go.id. Okay, and so that is the latest on the visa. But you can apply for visas now. This is not a tourist visa. These are not, you can't just show up and get a visa on arrival, but you can apply for a visa. You do need a sponsor to do that, but the application process works online, so you get a travel agent, and the travel agent, a sponsor, somebody from a travel company, or a friend or a spouse or whatever. Prices vary wildly. I've seen on social media from 3 million to 30 million and more. So if you're planning on getting one of these visas, shop around. Look for some recommendations before you put your money down, because there are people, a lot of people have been complaining about certain agents that they've used and they haven't gotten anywhere. And so this should simplify the process, and you should be able to keep track of what's going on. So good news for that, and it's a lovely afternoon. This is a Saturday afternoon. I'm going to finish this up on Sunday with the new numbers out, but guys are out fishing. There may be some rain tonight, but and it's pretty warm. Well, it's really warm, but yeah, it's lovely. And I think about, people say, don't you go anywhere? Well, I don't know. Why don't I go anywhere? I have my place up here in the 3rd floor, right, of the house. I've got my balcony. I've got the roof. I can, I just look out on the ocean. I've got a refrigerator full of beer and Coke and water and juice and cigarettes and internet and books, a bed to take a nap. What else do I need? So yeah, for me, traveling around isn't anything I'm really that interested in anymore. Right. Okay, so enough for the ruminations for today. Thanks for watching. Thanks for viewing. If you like this, give it a thumbs up. Leave a comment, questions. If you have some information that's different from mine, let me know. Always glad to hear what's going on, especially what's going on in other places. If you want to come in from Australia or Europe or UK or America or wherever, glad to hear about that. And be safe if you're in Bali. Follow the protocols. Help us get everything back up and running soon. And no, I haven't been vaccinated yet because it's really hard to find out what's going on with vaccinations here in Ubud in Bulang. I find out after things happen, and nobody told me, but I will get vaccinated eventually when I find out about when it's going. And I imagine somebody will say something sometime to my wife, and she may tell me. Okay, so take care, be safe, be kind to someone today. See you next time.